You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Ryan Lee, who is the co-founder and CEO of HireMe Healthcare. Welcome to the show, Ryan.
Thanks, Dr. Roxy. It's an honor to be here.
It is so good to have you here and to talk about your founder's journey, your commercialization journey, and the solution that you're bringing to the market that's so needed in the marketplace right now. But before we get into that, just share a little bit about your background and what you've been innovating these days.
Absolutely. So just a brief story of myself. I have a bit of a non-linear career path. I started out after I went to college at the University of North Carolina, which I will cheers with a national champions cup right here. We won't talk about last season, but I graduated from there, went off to Colorado, where I pursued a law degree and was first introduced to the behind-the-scenes component of entrepreneurship. So I was raised as an entrepreneur. Like both of my grandfathers and my dad all started their own businesses in various industries, and I was just always raised around this idea of putting your own ideas forward and really making something happen out of it. And I just figured that was the way of life my whole time as a kid. I was like, everybody does this, right? But yeah, I fell into the academic pathway there at the University of Colorado Law School and came out there, started a solo practice where I was representing a variety of clients, from those accused of crimes to those starting businesses. And it was the starting businesses side that stuck. So simultaneous to this, I grew up, my sister's a nurse. All my close people are nurses, some PAs, but I've always had a passion for helping nurses, and from seeing just the struggles that they have, the lack of appreciation they're given. And, I think they should all be paid $1 million a year, but that's probably not going to happen anytime soon. But, combining these two pathways, I was working at my legal job, and I had a lifelong friend of mine come up to me. He was working for a major hospital system and just ranting about all these inefficiencies in the system, how so many jobs were remaining open, these vacancies, how he knew so many qualified nurses and they just weren't getting together. The applications weren't even getting there. And a lot of the time this was due to just some algorithmic blocks and other components in the way. So he had a solution to it, and it was an online matchmaking platform to connect nurses to employers and to make it a one-stop shop for nurses. And what it eventually evolved to on the employer side is a matchmaking component where we have an algorithm that runs a lot on the background to try to find the best fit and focus on retention. Now, I figure we'll get into more of that later, so that's the broadest overview. But yeah, I became an advisor on this idea for a little while. I was actually overseas in Uganda. I'm a firm believer that that health is a human right and healthcare is a human right. And I'd been getting my master's in human rights at the time, and was working on bringing a health and energy-based initiative, startup within a startup, if you will, into refugee settlements in Uganda.
Okay.
I came back for the pandemic, and we were at a point where HireMe Healthcare, we had established the need, gotten great customer discovery, and the pandemic was in full swing. So we were seeing, this is really going to become an issue. Right now, no one wants to talk about this. There's a bigger fish to fry, at least in their minds.
Yeah.
So we decided to incorporate HireMe Healthcare, start the fundraising and startup journey, and that's what got us to where we are right now.
A very unique path to healthcare, I would say. Just a little side trip to Uganda. So let's talk about that just a little bit. I want to hear this story about smuggling your wife into your pregnant wife into Uganda. Tell us a little bit about that before we get into the business side.
Absolutely, and I'm just banking on the statute of limitations under Ugandan law, not holding up to prosecute for this down the road. But yeah, we found out we were living in Austria, about to head down to Uganda. We found out a week before we left that my wife was pregnant, and we had a yellow fever vaccine on the schedule for her the days leading up to it. Now, yellow fever vaccines are one of the harshest vaccines out there. The potential for complications is high, and the fact that it's just ultimately, I believe it's a live virus, and it's but regardless, there's a straight up you do not do this while you're pregnant. So
Yeah. Yeah. Yeah.
we couldn't leave her behind. We got on the plane. We landed in Entebbe Airport outside of Kampala, and while we were walking through, I was just like, they're either going to turn us around. I've been to a lot of countries that have yellow fever vaccine requirements, and the spectrum of enforceability is quite broad. So we were like,
Yeah.
it's just
Yeah.
what it is. And so when we got there, I noticed it was very stringent, and it was we'll turn you right back around right here. So it's like, oh no, let's think fast. And I bought some time to think because there was an Eritrean woman who needed help filling out her passport, or her entry card in English. So I
Mm.
sat over there with her, let the crowd dwindle a little bit, helped her get through. We kind of walked up, and as we were getting up there, we came up with a big group of people that had just influxed. And I looked around. I was like, just do exactly what I say, please. And I walked up. I showed him my yellow fever card. I then fumbled it, dropped it behind him, so he had to turn around. And while I was standing there, and she just skirted on right behind me, went in, and yeah, we got to go to Uganda.
Brilliant, brilliant. And, you know, what a testament of your determination. And, you know, who knew that that would be on the ground training for the next phase of your career as a
Exactly.
founder?
It's training in moxie, Roxy.
Right, right, exactly. Yeah. Uh, so let's get back to the business conversation. So talk about where you are right now. What are some of the strategies that you have implemented so far that have been a success for you? And kind of just kind of painting that picture a little bit of some of the high notes in this founder's journey.
Absolutely. So, it's a marketplace. So our biggest challenge would be the chicken and egg scenario, that entry level.
Mhm.
How do we get this off the ground? Both sides want the other. So our biggest success in commercialization so far has definitely been in relationship building with nurses. And that's been a
Yeah.
whole team effort. Our director of nurse relations, Denise, has done a phenomenal job. And it was a slow play. We didn't have the immense resources to just do an in your face, wherever you are, here's HireMe Healthcare popping up in front of you kind of marketing campaign. And nurses, rightfully so, are not terribly willing to trust a lot of entities right now. And so we had to establish that trust, and that was a large effort on Denise's part of just consistently marketing. A lot of times not getting responses. We had a huge list of all the licensed nurses in our state of North Carolina where we were launching, and she just had to slowly work through, pick the ones that seemed like they would be most engaging, find them. Finally, they're starting to get engaged. We have surveys going. We were able to do some focus groups with them, but it still took a long time for them to say, okay, I'm going to download an app that helps me get a job, because honestly, I'm not even sure I want to stay in this profession right now.
Right, right.
And
Yeah, true.
yeah, so we've just started to see 100% month over month user growth in Q3 of this year. It was growing steadily and surely, but it just turned to an exponential looking curve, and that's been a market success for what we
Hmm.
what we really need to do, and it's obviously exciting the other side very much. Um, so yeah, that's one of our biggest successes, and I couldn't remember if you said you wanted to hear a few or a kind of a highlight. Be happy to share some more
Yeah, what
lesser
I mean,
successes.
I would just say, you know, a lot of innovators that I speak to that have had, you know, been able to build and scale, you know, millions and billion-dollar businesses, you hear a common trait of, you know, whether they describe it as luck or timing or whatever that is, there seems to be something that is very similar to what you just described, where there's a timing thing of there's a market opportunity that's opened up, and you strategically or coincidentally happen to be there to deliver, to solve a problem that becomes a little bit more pertinent and being able to solve because of those changing market conditions. And there's no better time than now for what you're doing.
Right. Well, we started our commercialization right at the end of the pandemic. We'd done years of customer discovery before, but it led us into a situation where nobody wanted to talk about staffing, and and it made sense. It was, we have to get equipment, we have to get beds, we have to
Save
get a
lives.
vaccine. How
Yeah.
do we, everything else there. So no one was talking about permanent placement. All the while, nurses are getting sick and more help is needed on the floor. I mean, it's always been a shortage, but now they were like, oh, wow, this shortage actually really stings. And we should probably have done something about that a long time ago. But they filled it with travel nurses. And it got to a point where agencies were price gouging, charging up to $250 an hour, which would be
Hmm.
lovely to make as a nurse if they saw, even half of that. But
Right.
it got to a point where it pushed the system to the brink of its very survivability. I mean, putting hospitals in negative operating margins, almost over 80% of them. So this travel nurse, there's always going to be a need for travel, and there always has been. But applying it to everything was what we learned was a dire mistake. And that bubble burst very quickly and is receding to how do we get these permanent roles filled? So we have
Hmm.
that timing on our side of in the aftermath and the realization that we need to have these sturdy roles filled and we need to have them filled on the ready for if something happens again, or just to get through this day where our patient outcomes are affected by not having as much. And,
Hmm.
it comes down to what are the three they say? It's team, market, and timing. Market's there. The team is definitely there. We're very proud
Hmm.
of our well-rounded team from all of our backgrounds, but it's hitting that timing, and I believe it'll continue to be very beneficial for us that people are recognizing the importance of one, finding permanent placement nurses in much higher volume, and two, in finding the right fit. And that's where our matchmaking component comes in. So I think right
Yeah.
now, with retention and turnover being such big issues, people are looking for a solution for long term placements, and we have that. But just to conclude, you mentioned the luck component too, and there has to be some of that involved. It's what I tell my team right now while we're out pursuing these really important sales at this critical time. And when they say, what if I'm unable to close this deal? What if I'm not able to hit the numbers I'm supposed to? Will I have let down our startup? And I'm like, absolutely not. There's so much luck necessary. I mean, even there's so many things beyond our control that are important to have happen for our success, and recognizing that so we can focus on the things that we can
Hmm.
control is important.
Hmm.
That
Yeah.
person has to be sitting at their phone at the exact right moment for a cold call to come through. It might be the perfect person to talk to, but what if
Yeah.
they step to the bathroom and you missed them? You can keep calling, but there has to be that luck of so many things happening, and we're always looking for that.
Yeah, yeah, definitely. You mentioned customer discovery a couple of times, and that's a strategy that I've talked about on this show quite frequently. But I want to just kind of get your take on it. What were some of the advantages or positive outcomes of going through that discovery process, and maybe some of the challenges along the way?
Yeah, so the positive outcomes came, I think, that relationship building driven
Hmm.
nurse explosion, if you will, that I described, as it had a lot to do with all we learned during customer discovery, because it helped us tailor our messaging towards what nurses are really looking for. You can't just make that assumption. I mean, everyone assumes, for example, that the biggest issue is salary. It's number 4 on the list of nurses' concerns and reasons for leaving, for either
Yeah.
to travel or just to leave altogether. And having that advantage of having talked to so many hundreds of nurses and getting all this feedback from them really helped us in that regard from our marketing. It helped immensely for development. There's the Eric Ries lean startup method. Don't
Hmm.
build it until what you currently have in its most basic form has been validated by the market. Well, we got to do that by putting out our iterations into this group, and we haven't
Yeah.
added anything. We've added several things that are important, but we haven't added anything that we didn't get verification from our user base that was something that they wanted at this time.
Bravo.
Thanks.
You saved your company millions of dollars.
Absolutely. Yes, that's the
Mhm.
goal.
Mhm. Mhm.
Some of the challenges, as you also asked, it's hard to get customer discovery from our employer side of the market, particularly in the enterprise level, because
Yeah.
everyone is so overworked. It's one thing, nurses are incredibly overworked, but giving them an opportunity to vent about something to a party who's there to help them is a little easier than, hey, nurse manager, let's talk about what you could be doing differently to succeed, and let's make this not sound like a sale, which is ultimately the long play. But
Yeah.
let's it's hard to get the right people on the phone in those, especially in the large organizations. And when the first question of customer discovery is, can I borrow some of your time, people are like, I don't have that for myself, I can't give that to you.
Yeah.
So
Yeah.
it took a lot more no's in that avenue. And that's a hurdle because you need both sides.
Completely, 100%. One of the other things that I hear often is just the time, right? Of the time that it takes to do customer discovery, and when does that end for you to kind of, you know, most innovators want to move fast and furious for a number of really good reasons. But when does this customer discovery process end so we can get down to business? And I always say, never. Sorry. But really, you
Never.
want to be doing this until you close the doors, because it allows you to keep a pulse on those ever changing customer needs, and being able to, tweak and modify your product or product solutions, to those to solve those anticipated problems.
I could not agree more. It never ends, and as you said, it shouldn't. It's so valuable, and it saves. You mentioned joked earlier about saving millions of dollars. It really does save so much to just have that constant drip of communication, no matter
Yeah,
how potent. When it's not your entire focus, it still has to be at most a secondary or maybe tertiary focus, depending on what your team is, what your team composition, your resources, and where everyone needs to focus. But if nothing's happening in the customer discovery sector, you kind of are on pause.
sure. Yeah, 100%. So you mentioned an AI based solution, and obviously that is a hot topic right now and probably will be for many years to come. So let's talk about what it means to have an AI tech enabled solution, and some of what you're able to do at scale, with your solution particularly. And I'm very much interested in having a conversation around the biases. We have a lot of conversations around the biases that are built into data that AI is using. But in some of our previous conversations, you talk about how this is a tool to eliminate bias, which is very different. So tell us a little bit more about that.
Certainly. As we prepare our matchmaking algorithm for our roadmap where AI can drive it, how it comes in, copious amounts of data. And that's where the risk comes in, because it comes down to, how do you get that data? We don't have the professional information of every nurse until they sign up. And a lot of the matchmaking component would be driven by natural language processing. That's where the roadmap goes. And some of that brings in, how do you obtain the data, and what is appropriate to use. And I believe that by using it from an entirely textual basis, it plays against the biases in some way, because it's just putting everything down into what something is on paper. And so at that point, the biases that come in, we there's always the issue. I mean, as rough as it is, that when people are looking at in applications, someone's name can be something that they use as a bias to assume certain minority status, and that's been a big issue in hiring. They try
Yeah.
to, we did that in the beginning. We wanted to make this as personal of a profile as possible, but we decided against using photos of people on there. We allow them to upload it for their own, and for when we include more of a social media component where they can talk. But ultimately, we're trying to do everything to just level the playing field. So
Mm-hmm.
what our matching algorithm does first is it ranks everyone by their qualifications. So before you have anything you can see about their personal history or anything else, what you see is how well fit they are for your job. And so at that point, you're leaping ahead of someone's potential. I want to read these resumes first for whatever underlying biased reason they might have. You take that out of the other ways that application materials get to somebody. It's all done by a machine here. It
Mm-hmm.
finds the people that are most qualified, and I think that levels the playing field a lot. But as we bring more AI into it, it's something we have to be very careful with, and it's something that we'll shop with a lot of experts and make
Mm-hmm.
sure that as we continue adding more and more textual based data towards a natural language processing component that can match make people based on deep components of what it determines from their personality, because you have to be careful with that too. It's If it's
Mhm.
just scrubbing their social media, what is it scrubbing it for, and what data is included? You have some influence over that. But I've been listening to a lot of AI ethics podcasts. There's one I just listened to from Code 2023 the other day where
Yep.
they're talking about once you start training these machines to train themselves and to learn, um, they it's hard to totally lasso in what they're going to teach themselves. And so, by removing all human aspects of the matching component from the beginning for one bit, because our goal is to humanize the process, by eliminating all human aspects for one bit of matching, I think it really helps eliminate some of those potential biases. Then it creates a matched component. But we have to be very careful, and we'll be very careful when we continue exploring how to bring in more components,
Mhm.
because I'm very nice to these machines, because as they gain, I'm very polite to Chat GPT, for example, or I even gave him a name. And we're, when they learn more and more, which is entirely unpredictable on our part, where it's going to go, we have to make sure what we're training them on. That's obviously one of the biggest fears of AI overall. I could go on
So
about that for a long time.
yeah, definitely. So, within this market right now, I mean, I don't think that we would come across anyone in healthcare that isn't already acutely aware of the nursing shortage that we have and the burnout or dissatisfaction that nurses have. So, there's a real big need both on your supply and demand side of your platform business. So, are why is what you're doing so important and so different than what's already available on the marketplace for being able to solve these problems?
First and foremost, it's our focus on retention, and that's just become the most critical component. It's the fact that we've been taking this towards a human process for a while here, and have really emphasized finding the people behind the paperwork. It matches up with our customer discovery. What do we hear the most from both sides? They
Mm-hmm.
want to learn more about the person behind the resume before they get to the interview level. So we've already made it possible to do that. And on the applicant side, they don't want to just know the job description cliche, we're like a family, because first of all, hardly ever true. Second of all, what does that even mean? They
Yeah.
want to know more about the unit they're going to be working with. And so we're really emphasizing that component. And there's a lot of entities out there, a lot of organizations, and from specific in the permanent placement space all the way up to the job boards like ZipRecruiter and Indeed, that just focus on finding someone who's capable of doing the job. And to which question I often ask people, have you ever had a job that you were able to do on paper but were not a right fit for and therefore left? And I see your check, and that you are in the vast majority with that
Right.
check.
Yeah. Yeah.
Myself as well, and everyone else in our team. So we've all experienced
Mm-hmm.
this. This plight is not unique to healthcare. It's an issue with hiring across the board, and it's really important here though, because finding more about those people, matching them based on components, and letting them learn more and more about what is the unit like, because so much you can't learn from a resume. Personal development, career goals, why they're currently
Mm-hmm.
leaving, why they're seeking a new path. They might be the most perfectly qualified person for an ER, but they don't want an ER job right now. And there's reasons why that can be
Yeah.
appealing to certain employers, and other employers might say, that's not the right fit for our team right now. By getting
Sure.
those things taken care of, there's a lot of things out there's a lot of solutions out there that can find someone to fill a role. But when you find someone that fills a role for 30 to 90 days and leaves because of a bad fit, then you actually did more harm. You
Yeah.
compounded the problem,
Mm-hmm.
because you filled it, they paid for the training, they paid for the onboarding, they had an opportunity cost that could have been the right fit working there. And then when that person leaves, the average cost to replace an RN is $52,000. That's money out the door, when it's worse to find the wrong fit than it is to find no one at all in many cases.
And yeah, because I mean, one of the things is I think high attrition negatively impacts culture in a ways that we have not really measured yet.
For sure. I had a previous job where it turned out it had the highest attrition rate of any similar organizations in the state. And lo and behold, a lot of people turned over while I was there, and it impacted people on a day to day level. You can see it in the morale, you can feel it in the energy in the room, and
Yeah.
units have to be so cohesive. They have to be. That's why you can only have so many travel nurses on a given unit, because they're still learning the basic protocols, because every protocol is different. I mean, the basics of where the gloves are is often different in certain places, and just
Mhm.
having those long-standing relationships where people know each other, they know where each other's strengths and weaknesses lie, who to call for what specific issue, or to lean on for something that they just need to vent about or want to resolve, and need to get through to carry about their day. If you don't have those proper relationships, it impacts all the way down to patient outcomes, and we're all feeling it.
Yeah, definitely. Firsthand.
Very
Um, so, we talk a lot about on the show about commercialization and growth and scale. What's one of the strategies that you're using to kind of build that brand awareness or create that demand that would be of interest for us to talk about here?
Well, I have what we are using, and I have what we're most excited about using once we raise funds here.
Yep, yep.
What we are using to build that brand awareness is, the standard channels: LinkedIn, Facebook, all social media. We've gotten into the TikTok game, something I never thought I would say as a millennial from '87.
Right, right.
And those have actually been very impactful. People really listen to and and what our director of nurse relations, Denise, is putting out there is, a lot of personal content that she's putting herself out there with, and it
Hmm.
resonates with people. And it's been, we've gotten a lot of feedback from nurses from states we're not operating in yet, just saying, when are you coming here? We love your focus on individuality. No one else is doing this. And they're getting this from TikTok campaigns that just happen to be playing in a state far away from where we're currently targeting.
Yeah, yeah.
So that
Hmm.
personal aspect has been very useful in attracting those talents. And then, what we're more excited to do from a technological standpoint with the proper funding is this idea of geofencing. And
Hmm.
it ain't cheap, but it is a great way to really get in front of the right people who would be the most interested in what you have. And for example, in our case, what that would be is geofencing around. There's an area in Charlotte where we're based that has a huge medical center presence. It's multiple right next to each other, and geofencing around those areas, particularly on late nights. Most of the people you're going to see on their phones, patients that are there at 3 a.m, are probably not going to be on their phones, and if so, it's in a small minority. It's going to be the medical professionals there, and that can include doctors. But doctors seeing, oh my gosh, my unit is so understaffed tonight. This is just the night that will never end. Oh wait, here's a way to hire nurses, and they'll stick around, and it's affordable. So you can hit every aspect of that. But it's a great way to get before nurses and really get a lot of ROI on the investment you make in marketing, because you know that you're not hitting so much of the wrong target audience.
So let's just peel that back a little bit. What is geofencing for those in our audience that have no idea what you're really talking about?
Yeah, geofencing is I'm no expert. I would, if this was Who Wants to Be a Millionaire, I would phone a friend. No, but it's a technological approach towards marketing where you're able to use a geolocation as the main source of what you're putting out there. So it basically only will advertise in the regions you select. So you're not paying for all these vast areas of people that aren't there. So it can be a zip code, it can be an address with a radius, it can be as broad or as narrow, which is the coolest part of is how narrow it can be.
Yeah.
And
Yep.
it's a way to just target all those individuals in that way. So in there, if you have a geofence campaign for a specific address that to be a large hospital, and you set it between X hours, I mean, it works during the day hours too. You're not getting a ton of people that are just hanging out on their phones, but what it does is it puts that ad in there. The way when you're scrolling through a browser, you see these ads, and sometimes you're like, "Why is this so appropriate?" It's very possible they geofenced you. They knew where you'd be at what time, and therefore what is more likely to interest you. And it's a great way to just get people hyper targeted information that way.
That is the word that I love, is hyper targeted. So, I would compare that to, doing hyper targeting advertising, let's say on a search platform like Google or YouTube, where it's really requiring that user or that consumer to take some kind of action to trigger displaying that ad. Whereas the geofencing, like you're describing, is it really doesn't take any trigger or action by the consumer or person, except for being in a very specific geographical location. Right?
Exactly. I mean, that's why so
Uh-huh.
many times we think, how did it read my mind? I didn't say those words out loud, but it advertised that to me. It's like, well, they knew that people where you are when you're there are way more likely to be thinking about or considering or talking about what just popped up.
The non-healthcare example that comes to mind is driving in a 1 mile vicinity of a Starbucks and getting a text message with a coupon or getting
Exactly.
some type of ad in real time. And then all of a sudden you're like, never was thinking about going to Starbucks, but now I feel compelled to do so.
Yeah,
Just
and
in time marketing.
that's amazing. And if the radius is too tight, it might cause some traffic issues. So you might have to
Right,
be nice and smart.
exactly. Yeah. That's why they
Wow.
have all those lines at Starbucks, maybe.
Oh, the Starbucks. I just didn't know it was discounted.
Right,
now,
right. Yeah,
now it found me.
exactly. Uh, so let's talk about, what's happening in your sales strategy right now. We've talked about some of the things that are working really well. Let's talk about some of the challenges that you've had in this commercialization journey.
Sure. There's a lot of trial by fire in the world of entrepreneurship, and we've had some learning experiences along the way. We began primarily targeting whales, as we call them, major health systems for an enterprise contract, because we land one of those and it's we obviously make money by volume of placement, so I don't really have to explain too far why that's a good thing.
Yeah.
And we also did, on the other side, to balance it out, a lot of independent practices and clinics, and we learned that those are not necessarily our best fit right now because a lot of their needs are CMAs, and CMAs are really hard to convince to do work right now because their salaries are less than a lot of fast food cashiers, and their responsibilities have been only increasing. And
Mhm,
I can't,
mhm.
in my right mind, even tell a CMA to take a certain job until some changes are made. But it's a
Yeah.
hard find for us. So we learned, not so much on that side. Great lesson. As we pursue the enterprise side, we know that there's long sales cycles, but we figured the way we timed it, we could work certain enterprises simultaneously and it would take hold, and all we really needed is one. Then that FOMO comes in, they're using it, we'll use it. But we've had some major setbacks that were just unforeseeable. We got in with one of our ideal clients on two separate occasions. Once through their HR department. It's hard to navigate these decision maker trees and
Mhm,
bureaucracies to
mhm.
find the right people, but we did it. And we got in through their HR department, asked for an LOI, didn't hear back for a little while. Turns out in that period, the week after, they laid off several members of that HR team, including everyone who was a touch point in our conversation. So we were back to square one. We
Yep.
later got in with the same system through the innovation department, and then they laid off the entire innovation department. So it's been setbacks like that where you're just reminded that not only are these sales cycles long, but they can almost be reset. And that's kind of a make or break situation. So,
That's
mergers,
where you
those
start
impact.
saying the mantra, "I get that knocked down, but I get up
Yeah.
again."
Who knew this better than Chumbawamba? Absolutely.
Right, exactly.
So we're just tub thumping our way through this, and we've really narrowed our focus now to take a volume based approach towards mid-size ambulatories, skilled nursing facilities, home health, smaller, more independent hospitals. Remote and telehealth jobs are a big part of it, and we're doing this volume-based approach, and we're getting a lot more. There'd be smaller contracts, so not the ones that are going to take us to unicorn status overnight, but it's important to have those placements and to
Mhm.
be able to fill the needs. And honestly, so many nurses are leaving large hospitals for these jobs. We talk to a hospital and they say, we lost all of our nurses to ambulatory centers here in town. And
Yeah.
so, we like to have that option open to nurses as well, to say it's not just about the hospitals. And it takes a lot to pivot on that, because you have to say, we're willing to make a lot less money while still putting in comparable efforts on pursuing, on the customer acquisition side. And
Hmm. Hmm.
it was an important lesson for us to learn. It shifted our strategy. There's been some hard lessons in there, as I said, and that's the beauty of entrepreneurship, is you just keep learning, you keep getting knocked down, you get back up again. And if you're a drinker, you take a whiskey drink, you take a vodka drink.
And let's do it again today.
Yeah.
uh, well, thanks, Ryan, for joining me on this conversation today and sharing your insights. Is there anything else that you would want to share with our audience before we wrap up?
Well, for starters, just that for those of the younger generations, that is a quote from the song about the whiskey drink and cider drink. And I just like to share that sometimes it's really nice to have some literature on your side. And I just learned that there is a hyper focused book that I can read about health innovators succeeding by a specific person who I happen to be on this phone call with. And I'm excited to read that book. I think that will be really helpful. I know people ask about book recommendations. There could not be one more appropriate for this. So I'm just going to play on that.
And I didn't pay him to say that.
She did not. No, I was briefed that we might talk about books, and that is the first book that I would recommend.
Um, awesome. Thank you for
But
that
yeah, as
plug.
far as this, we've just had some great advisors, some thinking partners along our path. And one of the most important things I think you can do in the early stages of a startup, especially, is finding advisors, finding expertise, and finding partnerships with those who you can't afford to bring onto your full-time staff, but can find other creative ways to have them in your network. And
Yeah.
when you're doing something that tackles a problem people care about, there's one box checked. When you're approaching that subject well, that's another box checked. And even in the early stages where traction's not quite there, they understand that you might not have, our startups don't always have the means to pay high-level consultants, but there are ways to navigate those relationships and to figure out a way where you can get that kind of input from people at a much lower cost. And it just comes down to being a genuine person. And I think that makes people more likely to want to help you. And by being yourself in those meetings, not tightening up and trying to be what you think other people expect you to be, people tend to relate with you more, and they're more likely to want to help you. And having those levels of expertise at an early stage is one of the most valuable things you can have, because Lord knows we can't do all this ourselves.
And being open and vulnerable or transparent about that reality is actually really popular right now.
It is. I feel
uh,
cool because thanks to my wife, I got ahead of the curve on that one, and it's opened up so many
that's,
doors. All the things that you feel like you don't want people to know because you think they judge you, it's
yeah,
sharing those things that make people believe in you and trust you and understand, because everyone has their stuff and their problems and their struggles. And when people are open to talk about those things, it's something we can all relate to. You find something in common with someone you might not otherwise have anything in common with. It's, oh, you struggle? Me too. And then there
yeah.
you go. It opens up a whole new door. Just being real.
And that's one of the key pillars of this show, of interviewing founders and CEOs like yourself, to be able to come and share the realities of this journey, so that way we can learn from each other, and being inspired and encouraged when we learn about a strategy that we, like geofencing, that we didn't even consider in our own commercialization journey, or hearing about someone's struggle kind of normalizes the difficulty of this journey. And we kind of start to think, it's not just me, I'm not broken, or I'm not a failure, I'm just like everybody else, having to overcome obstacles and hurdles to be able to get to this, building this $1 billion legacy.
Absolutely. That's why I love conferences that are littered with founders, because it's an audience, because nobody else outside of this space can truly relate to it. They're like, okay, I get it. You're a startup founder. You probably work a lot. Like, no, it's way more than hours. It's the 24 hours a day that it's in your head. It's the, when you
Completely.
start to dream about it. And when you're with other founders, you realize that everyone is going through the same thing. And it is just, that's what Health Conference earlier this month was kind of
Right.
just a vent fest for a lot of us going through the struggle. And it helped a lot. We all
Completely.
bonded quickly over it.
Completely, 100%. So, how can folks get a hold of you if they want to follow up with you after listening to this episode?
Absolutely. We have our website, www.hiremehealthcare.com, to learn a little bit more. You can submit a form through there. But if you want to talk to me directly, I take conversations all day. I love talking to people, whatever the interest may be, and just being able to learn from each other and share some ideas. So you can email me at ryan@hiremehealthcare.com. Or if you shoot me an email there, I will pass along my cell phone number as well.
Awesome. Thank you so much for joining me. And for those listening today, if you haven't already subscribed to the show, do so and feel free to pass this episode along to your friends and colleagues.
Nurses, nurse innovators, tell your friends. We would love to work together.
Sounds great. Thanks, Ryan.
Thanks, Dr. Roxy. Great to see you.
Thank you so much for listening. See you on the next episode of Health Innovators.